Hi, Dr. Tim here. I've created this video specifically for people who carry a lot of tension in their neck and their upper shoulders. And I just want to show you the favorite things that I recommend to patients who carry a lot of tension in this area. It's very common for people who spend a lot of time on the keyboard, people who sit a lot, or spend a lot of time reading or with their head down in a flexed position. So these are the things that I would recommend you do, keeping in mind that the ranges of motion in your neck really moves in 6 directions. You can rotate left and right as far as you can to the left and as far as you can to the right. You can laterally bend your neck to the left and to the right. And then you can also flex and extend the head, which looks like this, where you're tipping the head down and tipping the head back. So it's a good thing to get in the habit of just moving your head and your neck through a full range of motion very gently when you start out, when you wake up in the morning. And after that, what I'd recommend you do is either from a sitting or a standing posture, you can grab onto the bottom of a chair if you're sitting down and just reaching over with your opposite hand and very gently drawing or pulling your head to the side. And what you're going to feel as you pull the head to the side, you're going to feel a nice stretching through the muscles that come up from the shoulder and behind the ear. So I would hold that for 20 or 30 seconds, and I would repeat that each side, left and right. And then you can do a slight variation of that where you rotate your head slightly away and you're tipping the head down and across. And as you do that, you'll feel it pull a little less down the side and a little bit more into the back. And the reason that you're holding on to the bottom of the chair here or trying to keep the arm down is because you want to keep the shoulder down when you're pulling the head in the opposite direction to get the best stretch possible. Another stretch you can do is simply pulling the head straight down, tucking the chin into your chest, and pulling the head straight down. And again, you'll feel this one pull straight up the middle, right from the base of the skull all the way down to the top of the shoulder blades when you do this. You're kind of cupping your fingertips right under the base of the skull. Each one of these stretches I would recommend holding for 20 or 30 seconds and repeating 2 or 3 times. Another thing that I like to give patients who have something called anterior head carriage or forward head posture is something called a chin tuck exercise. And that's simply where you're lifting your chin up and very gently pulling the head back. And you're using what are called prevertebral muscles in the front of your neck. And as you do that, I'd recommend you hold that retracted position for 10 or 12 seconds and repeat that about 4 or 5 times in a row. And that's a great exercise that you can do periodically throughout the day while you're driving or standing in line at the grocery store. So these are some simple things that you can do. In terms of the upper back, I often tell patients just to get a tennis ball and put it behind their back, in between their back and the wall, and just work on rolling it around to remove some of the tension from the tissues and the muscles that are between the shoulder blades. If you have any questions about these exercises, how you're doing them, if you want me to make sure that you're doing them correctly, please ask me on your next adjustment because there's a lot that you can do that will relieve tension in the neck and the shoulders. Also, please make sure that if you have started doing your spinal corrective exercises that you are doing them faithfully every day, as close to every day as possible. That way we'll make sure we get the best results possible when we take your next progress x-ray. Hope you have a wonderful day. We'll see you for your next adjustment.